Well, I show that it's a little bit after 1 o'clock. We may still have a couple attendees trickling in here, but we'll go ahead and get started with some introductions. And first of all, I just wanted to thank you all for joining us this afternoon and spending some of your time with us on this Benefits 101 webinar today. My name is Erin Malone. I'm one of the benefits administrators here at CSU, and I am joined by my colleagues Jessica Fetters and Travis Vaughn. We are going to be your trail guides through our adventure today, which is a Benefits 101 presentation where we're going to learn a trail guide for navigating benefits to really help equip you with some resources for navigating, understanding your benefits, and making the best benefit decisions for yourself and your family. A couple housekeeping items before we jump into our content today. We do have the Q&A function available for you. If you would like to ask questions, please drop them out there. And Jackie Soro, another member of our benefits team, is going to be monitoring those questions throughout. And we will have some checkpoints throughout our time today where we will stop to check in, ask questions, have you give us some feedback as well, a little bit of engagement and participation. And yeah, we'll definitely stop for questions there as well. One final item is that this webinar is being recorded today, so I did want to make you aware of that as well. And with that, I'm going to pass it over to Travis to get us started.
Thanks for the intro, Aaron. All right, we'll summarize in this slide first what we'll be going over for this whole presentation. And where we'll be navigating first is packing the essentials, where we'll go over defining common benefit terms. Then we'll be hitting the trail, where we'll provide information on when you can enroll and make enrollment changes. After hitting the trail, we'll be navigating the trail, where we'll go over plan resources for you to find and understand benefit information. After navigating the trail, we'll be hitting a fork in the road, where we'll provide considerations and plans to help you choose the best benefit options for you. And lastly, we'll be reaching the summit, where we'll provide information and resources to help you maximize your benefits. All right, checkpoint 1, you should see a pop-up come up, and if you would just answer how you would rate your current understanding of benefit plans available to you as a current employee of CSU. And thanks for filling this out as well. We'll have a few other polls come up, but these polls definitely help us get some feedback on the presentation that we're giving for this one, and then just for future presentations and information on this as well. All right, jumping into it, packing the essentials and defining common benefit terms. Deductible is the amount you pay before insurance starts covering your costs. And so essentially, in the example we have, if your deductible is $1,750, you would pay the $1,750 before your insurance kicks in. Then after that, moving to coinsurance. We'll go over a little bit more information on deductible in a following slide. After you've met your deductible, then the plan will kick in and start covering a shared cost of your costs from there on. In this example, after you've met your deductible, your coinsurance would be 20%, and the plan and insurance then would kick in and start paying 80%. You would then, after you've met the deductible and are paying those coinsurance costs, in the event that you happen to incur costs up to a maximum amount, the plan would then kick in once meeting that and pay 100% of your costs from that point on. And from our example, your family has paid and met $12,000 out of pocket, then the insurance then would kick in and pay for any expenses above that. So the insurance would kick in then at 100%. You wouldn't have any additional costs beyond that. Copay is just a fixed fee for a service. So for example, if your copay is $40 for a doctor's visit, you'll pay $40 each time that you go and visit the doctor. Packing the essentials continued. Premiums would be the amount you pay out of your paycheck just to have the coverage. And at CSU, benefit premiums are paid for the month at the end of that month. And so, for example, for March's payroll just ran. So the coverage that you had for March, you paid for that coverage at the end of March. You can scan the QR codes there listed on the screen to view the premiums for your specific employee type. On the left-hand side, faculty, administrative professionals, and non-classified staff. And on the right QR code would be for state classified staff. Next term, maximum benefit. And this would be that most a plan pays for covered services within a set period of time. And our example is a $1,500 annual dental maximum. Means that coverage would stop after $1,500 in benefits have been paid and provided to you within that year. Allowance is a set amount the insurance plan covers for specific expenses. And for our example, we've got a $150 annual allowance for lenses on a vision plan covering $150 of that specific cost per year. Dependents would be an eligible individual that you cover under your insurance benefits. Versus a beneficiary would just be an individual or entity designated to receive benefits in the unfortunate event should something happen, like if you pass away, for example. And an example of that coverage would be life insurance. Terms continued. Pre-tax versus after-tax premiums. Pre-tax premiums are premiums deducted from your pay before taxes are actually taken out. And so this would be a little bit smaller of your earnings that would be taxed on. After-tax premiums would be premiums deducted from your pay after taxes, and that ends up being a little bit larger amount that's taxed on. So just for simplicity purposes, if we look at $100 for pre-tax premiums, and let's just say the premium is $10. We'll subtract $10 in premiums from your $100 in earnings, and then you'd be taxed on $90. Whereas versus after-tax premiums, you would be taxed on that upfront $100, so a little bit more of earnings that you're taxed on there. Embedded deductible versus aggregate deductible. An embedded deductible would mean each person has their own individual deductible within the overall family deductible. And the way I like to illustrate that is silos or cups within a larger silo. So once one person has filled up their cup and met their own deductible, the plan would kick in for that one individual on the family. And that would incur on for the different family members up until you've met the total family amount. And the way aggregate deductible differentiates is the overall family must meet a big deductible number before the coverage kicks in for any one person of that family. And the way I like to illustrate that is there's just one bucket. The whole family chips in the deductible and fills up that one bucket. And after that one bucket has been filled up, coverage would kick in for all family members. In-network versus out-of-network. In-network is services from providers with lower negotiated rates. Out-of-network are services from non-contracted providers, often costing you more money because those negotiated rates aren't in play for that network. And lastly on this slide, we've got health savings account and flexible spending account. Health savings account is just a pre-tax savings account for eligible medical expenses that roll over from year to year. And to be eligible for that plan, you have to be enrolled in a high deductible health plan. Flexible spending account is also a pre-tax savings account for eligible medical expenses. Although, unlike the health savings account, those dollars all don't roll over from year to year for the flexible spending account. They have more use or lose rules to them. All right, now that we've packed all the essentials and defined all of our common benefit terms, we'll be hitting the trail and understanding when you can enroll. First off, what happens for employees every year is open enrollment. And for faculty, administrative professionals, and other non-classified staff, open enrollment occurs around October through mid-November of every year, with changes being effective January 1st. For our state classified staff, open enrollment is getting ready to kick off really soon, and that usually starts around April through the end of April or May, with changes from that open enrollment being effective July 1st. Other times when you can enroll other than open enrollment is new hire enrollment and mid-year life events. As a new hire, you have 30 days from your date of hire to make your enrollment selections. Benefits are typically effective the first of the following month. And if you add dependents, documentation would be required for those dependents. And so outside of your new hire enrollments and the regular open enrollment that happens every year, you're also allowed to make changes should you experience a mid-year life event, such as birth and adoption, marriage, and change in other coverage, such as gain or loss of coverage. And you have 30 days to enroll and provide documentation for those events. And changes are effective the first of the month after the event or notification to HR, whichever is later. The only exception there is with birth and adoption. And with birth and adoption, coverage will always go into effect the date of birth. Something I want to caution there on mid-year life events. If you are experiencing a mid-year life event, notify us right around or pretty soon when that event happens. Don't hold and wait to grab and gather your documentation before you notify us. And I just caution that because of the caveat there that the coverage will usually start first of the month after the event or notification to HR, whichever is later. And so just to highlight that, so you get those changes in effect when you intend to, and possibly not have that fall the first of a following month after that. With mid-year life events, documentation is also required to be submitted for those changes to be approved. Dependent documentation requirements. With that, faculty, administrative professionals, and non-other classified staff, for a spouse would be marriage certificate, common law spouse, affidavit of common law marriage, civil union partner, civil union certificate, and domestic partner, affidavit of domestic partnership. For anyone adding a spouse or partner, for faculty, administrative professional, and other non-classified staff, a joint financial document dated within the last 60 days is also required to be provided, such as a household bill or bank statement. And for a child, adding a child would be birth certificate or adoption certificate. For our state classified staff, experiencing or adding dependents to coverage for required dependent documentation. For spouse would be marriage certificate. common law spouse, affidavit of common law marriage, civil union partner, civil union certificate, and child, also birth certificate or adoption certificate. And I just wanted to touch on for any required documentation, adding an affidavit. We do have some individuals in our office that are notaries. And so if you do reach out and want some assistance with that, make sure to contact our office and get in touch with our service center and schedule an appointment to make sure we have a notary there at the office and to provide you with any requirements ahead of that appointment. And so when experiencing a mid-year life event, if there's any dependent documentation required on top of that, there could also be some other documentation required for your event. And so for birth and adoption, you would provide a birth certificate or adoption certificate. For marriage, marriage license, common law affidavit, and civil union certificate, etc. And remember, for administrative faculty and administrative professionals and non-other classified staff, you would also be required to provide that joint financial document previously mentioned, dated within 60 days. For a divorce, required documentation would be a copy of the divorce decree. And for a gain or loss of other coverage, typically would be documentation on company letterhead from the previous employer or provider, highlighting a few things: who for the coverage has been gained or lost, when the coverage ends or begins, and what type of coverage has changed or been impacted, medical, dental, for example. And now that we've covered those things, I'll pass the presentation over to Jessica, where she'll kick off where you can go to make those enrollments. Thank you.
Thank you, Travis. All right, now that we understand when benefits enrollments can be made and updated, it's also great to know where to go to complete these enrollments. So faculty, administrative professionals, and other non-classified staff can update their benefits through the employee self-service accessed from the Human Resources portal on the AAR website. And to access the AAR website, you will need to be logged into Global Protect, which is the VPN, and you will also need to have Duo to be able to have that secondary authentication and verification. So keep your phone handy when you are logging in. You'll need that both for accessing AAR and again, also for the Human Resources portal. And then on the left side of the screen, you'll also see an option for CSU Benefits. So you can select that to make your enrollments. For mid-year life events, those windows will need to be opened by HR. So if you don't mind letting us know whenever you do have a mid-year life event, so we can open that window for you, and you'll be notified when that is ready to go. And then after logging into the portal and navigating to the CSU Benefits section, the first option for you is to add your dependents and beneficiaries. And beneficiaries do not require a social security number or documentation, but dependents will require both. After you've updated your contacts there, you can move forward to actually select your plans. And then for state classified individuals, your benefits are updated through Benefit Solver. And the website is also linked on the right side of the screen and listed out for you too. Mid-year life events can be kicked off through Benefit Solver as well, so you do not need to notify us first, but we still appreciate a courtesy notification so we can help you along the way, answer any questions you have, things of that nature. Documentation for dependents, if you are faculty, administrative professional, and other non-classified staff, can be sent directly to us and we'd be able to take care of that for you. And if you are state classified, you can upload those documents directly to Benefit Solver as well. All right, so far we have packed our essentials, hit the trail, and now it's time to begin navigating our trail. And to do that, we will touch on 3 key resources that will help make decisions when you are choosing your benefits plans and are good to review every year during open enrollment. And those 3 documents are the Summary Plan Description, or the SPD, the Summary of Benefits and Coverage, or the SBC, and Explanation of Benefits, or the EOB. And so the summary plan description, or the SPD, summarizes information about different benefits plans that are available to you, and it includes information about all of the benefits, so medical, dental, vision, and other benefits as well. It lists information about who is eligible, coverage and costs, process for submitting claims, and contact information for vendors. And it's always great to look at this every single year during open enrollment, even if you are satisfied with your plans. And then the summary of benefits and coverage, or the SBC. It's a little similar to the SPD, or SPD, I'm sorry. And the difference is that it has lots of key details that are specific to each plan individually. So there are separate documents per plan. Information that is included on there includes the deductible amount, copays, coinsurance, information about the provider network, some examples and samples about different events, like a mid-year life event, and how that would impact you financially to help make your decision on which plan to choose. And it also lists information about services that is not covered by that plan. SBCs can be found on our website, as well as the SPD. And then here is some examples of what the SBC could look like. So for faculty, administrative professionals, and non-classified staff, our medical plans are through Anthem. And so on the left side of the screen, this is what the SBC would look like for any of the Anthem plans. And then on the right side of the screen for state classified staff, medical coverage is through Cigna or Kaiser. And so those examples are listed there as well. And then the explanation of benefits, or the EOB, is slightly different. This is something that gets sent to you after an insurance company has filed a claim. And there are a couple important pieces of information that is listed on this document. It lists out the total charges for a service that has been incurred. It also lists the amount that an insurance company has negotiated to pay. It lists the amount the insurance company will be paying. It also touches on the amount that will be subject to your deductible or your copay. And the most important part is the amount that is asked to be paid by the member or the patient, or by you. And if you have any questions about information on this document, you can reach out directly to that insurance provider or the facility that you received the service. And this EOB example is general, but it does look different based on every company. So it doesn't always look like this. And now we have reached our second checkpoint. So we'll take a moment and pause if you want to scan the QR code and just check in to see how you're feeling about your understanding of the benefits. All right. Next slide, please. Thank you. We have now discovered a fork in the road, and the following are questions to consider when picking the right benefits path for you. And so these questions are a great starting point, but they're not including all the questions that may come up. So some key questions include: which plan options are available and how do they differ from one another? What are the necessary coverages needed for myself and my family if you are adding any dependents onto your plan with you? How do you want to allocate your healthcare costs? And what financial tools are available to help you manage healthcare costs, such as the HSA, FSA, things like that. And as a benefits eligible employee at CSU, you are automatically enrolled in a few benefits. And for faculty, administrative professionals, and other non-classified staff, those core benefits include the medical employee-only green plan. You could still waive this if you would like to, but otherwise you would automatically be defaulted into this plan as well. And it is free for employee-only coverage. You'd also be enrolled into the short-term and long-term disability, basic life and AD&D insurance, which is accidental death and dismemberment, and employee assistance programs, as well as the retirement plans and contributions. And then state classified staff have similar benefits, but a little bit different. So those core benefits include short-term disability, basic life insurance, accidental death and dismemberment, and employee assistance program and retirement contributions. And in addition to the core benefits, there's also voluntary benefits that you are eligible to enroll in if you so choose. And faculty, administrative professionals, and other non-classified staff can choose different medical plans that are available, two options between two different dental plans, vision coverage, additional voluntary life insurance, including spouse life insurance and child life insurance, additional AD&D, supplemental plans such as the accident insurance and hospital indemnity, and flexible spending accounts, and other additional retirement contributions. And then state classified employees, similar to the core benefits, have similar voluntary benefits, but just slightly different. There is medical options available, and there's two different providers, either Cigna or Kaiser. And then I believe there are two different dental plans available and two different vision plans. And there's also additional life insurance that you could purchase, including spouse life and child life, flexible spending accounts, long-term disability, and additional retirement contributions. And all employees that are eligible for benefits at CSU have additional benefits options available as well outside of the typical insurance coverage. And that includes academic privileges, such as the employee study privilege, which CSU will pay for a certain amount of credits every academic year for courses taken at CSU or other institutions. There's also the tuition scholarship available for your dependents as well that are attending CSU. There's well-being programs, including the Employee Assistance Program, the Employee Housing programs, the Hardship Loan, and Family Medical and Parental Leave. And then my favorite is the discounts through the Commitment to Campus, or C2C. And if you scan the QR code at the bottom of the screen, it will go to a website that lists all the discounts available just being a CSU employee. But some of those important or popular ones are the fitness programs, um, parking discounts at the airport, CSU vet care discounts, and tickets to sporting events, but there's a lot more too. And I'll pass it off to Erin to help us reach the summit.
Thanks so much, Jessica. So we've almost made it. We've gone through a lot, and we are now going to reach the summit where we'll talk a little bit about maximizing your insurance benefits and some cool resources available through each of our specifically medical insurance providers, but there are tons of resources out there for sure. The first point we really want to emphasize is preventative care. And I know it's not fun going to the doctor. No one really loves that annual checkup, but preventative care has been shown to save you a lot of money in the long run and hopefully have some early detection of preventable conditions and get treatment that you need sooner rather than later. So really can't emphasize that enough, how preventative care is so crucial to your overall well-being. And in-network preventative care is covered at 100% on most CSU medical plans. So you actually are not going to pay for many of these services, such as annual physical exams, cancer screenings, and vaccinations. Those are going to be covered by the plans. So by not taking advantage of preventative care, you really leave that benefit on the table. So we definitely want to emphasize that. That is probably one of the biggest ways you can maximize your insurance benefits while also just looking out for your overall health and well-being. Additionally, certain plans through Anthem and Cigna and Kaiser offer low or no cost telehealth services. But we do encourage you to consult the certificate of insurance documents that Jessica brought us through earlier to view the specifics based on your coverage and what your plan allows. The second thing we want to talk about when it comes to maximizing insurance benefits is that finding in-network care is key. In-network care offers the highest level of service at the lowest cost with those contracted in-network providers with your insurance carrier. So whenever possible, find that in-network care. It's going to save you a lot of money in the long run. And then you can find doctors that you can build relationships with in your network so that when you're doing those preventative exams, you have that relationship built up for when bigger life things come up like accident or illness. For our faculty, administrative professionals, and other non-classified staff, our insurance company is administered, or coverage is administered through Anthem. And there is a really cool, useful website on their tool for finding in-network care. On their website, if you just go to www.anthem.com and select Find Care, it's right there on the homepage. Then you can either log in and it'll do a personalized search based on your area using your zip code and your network. However, if you don't want to log in, you can also just select Use Member ID for basic search and use the prefix OLU to search for providers in the Anthem network with the CSU plans. That OLU is going to be for all of our plans, so you can use that, and then it'll have you update your zip code as well, just to find providers in your area. One very important distinction on the Anthem plans for faculty and administrative professionals and our other non-classified staff is that if you are enrolled in the Colorado Pathways plan, that plan does have an exclusive provider organization network where you have to see doctors within that specific Anthem network. Coverage outside of that network is not provided outside of emergency services. So super crucial you do find a network care if you're on that plan for that exclusive provider organization network. There's a QR code here on this page that you can scan that will take you right to that network directory for that EPO network I mentioned, but did want to call that out specifically. For our state classified folks, both Cigna and Kaiser, our two insurance providers, also have a similar tool on their website for finding in-network care. So really useful again to find those doctors that are going to be in your network to get the highest level of coverage at the lowest cost. For Cigna, you go to their website, which is just www.cigna.com. And again, right on their homepage there, you'll select Find a Doctor. It'll ask you, how are you covered? And if you are enrolled in one of the state of Colorado medical plans, you will select, through CSU, you will select employer or school. And then you can search by zip code and your preferred method of searching. So you can choose by type. You can look up a doctor by name if you have someone in mind. You can look up facilities. Again, it'll give you the option to log in for a more personalized search where kind of all your information's preloaded and you don't have to worry about entering zip code and things, but you can do continue as a guest to just search kind of generally. The state of Colorado Cigna plans are in the Cigna Open Access Plus network, so you can use that if you do just a generic search. And last but not least, we have Kaiser Permanente. If you do visit their website as well, which is just healthy.kaiserpermanente.org, you'll see on their homepage where it says doctors and locations. You click on that, and then it will open up a list of regions that Kaiser is active. Select your region, and then it will take you right to a page where you can just search for additional details using your zip code. You can enter keywords if you have a specific type of doctor you're looking for, like need to find a dermatologist. You can enter that in, and it'll help you find those in-network providers for Kaiser. We have several online resources available for our staff as well. For faculty, administrative professionals, and non-classified staff, we have our Alex tool. Hopefully some of you are familiar from past open enrollments or maybe when you were a new employee. Alex is a virtual benefits counselor. It's a super fun interactive tool where you can plug in some information about yourself, your family, how many times you go to the doctor, estimates like that. And Alex will actually run all those numbers for you to help suggest a plan option that might be a best fit for you. And it will do that for medical, but also some of our other benefit plans as well. So it's a really good resource for navigating and just learning more really about the plans that are available to you. All of our medical insurance vendors also offer mobile apps that are really useful. On the left side of the screen here, you'll see the Sydney app for faculty, administrative professionals, and other non-classified staff. This app is really cool. It's connected to Anthem, you can download ID cards, you can track your expenses, see how close to meeting that deductible you are, find in-network care through that app as well. And it also has fun health challenges where you can create challenges, share with colleagues, do some healthy competition. And then our state classified staff, Cigna has an app that has very similar features for downloading ID cards, finding in-network care, and tracking costs. And then Kaiser as well. They also have a similar app for those exact purposes. Those are available in just about any app store. So definitely recommend if you like that, if you like applications on your phone, they're really good resources for just having easy access to all that information through your provider. Each of our medical insurance providers with CSU that partner with us also provide benefit concierge services that are very awesome resources. So for Anthem, we do partner with Anthem to offer Anthem health guides. You can access those in the Sydney app or by calling the phone number here on the screen. Health guides are really there to help you navigate all things Anthem. So whether that's a claim you had questions about, if you've got an EOB from Anthem and you're wondering about some of the things on it, anything like that, you can help. Those Anthem health guides can help. Cigna for our state classified staff has Cigna One Guide, which you can access through mycigna.com or by calling that number there on the screen. Similar, they will help you with anything related to your Cigna coverage if you want help understanding how your copays are applied, or if you are curious about an explanation of benefits again that you received that maybe you're not quite sure how the numbers are lining up. They are excellent resources for helping guide you through all of that. And then Kaiser Permanente has their KP Copilot program, which can be accessed by that phone number. That is specific for State of Colorado employees as well. So they're very familiar with our Kaiser plans. They can help you compare plans, especially during this upcoming open enrollments. If you have questions about your current coverage versus what you might be looking for in the future, they're a really good resource for that. The KP Copilot program, though, I do want to note, is only available Monday through Friday during business hours, 8 a.m. to 6 p.m. And a couple additional reminders for how to maximize your insurance benefits here at CSU. We do offer wellness incentives for both our faculty and AP staff, as well as state classified staff. For faculty, administrative professionals, and other non-classified staff, we participate in our annual Fit Life Wellbeing Incentive. Details of that are usually announced around the end of the year. So if you keep an eye on your email, it's usually kind of concurrent with open enrollments if you are paying attention to that. And that offers you the opportunity to complete certain well-being tasks to earn a $150 incentive that is applied to your paycheck the following spring. State classified staff have access to the Colorado State of Health State Wellness Program, which offers all kinds of resources for helping you maximize your health. They offer health coaching and all kinds of things. They also offer a similar program where if you complete certain healthcare related and well-being related tasks, you can receive a discount on your insurance premiums the following year. So really cool programs to help you incentivize you to help take these matters into your own hands and explore some of these well-being opportunities and receive a little bit of an incentive for it. The next point here is that our amazing HR Service Center staff is available for virtual appointments with human resources using that QR code. So if you scan that QR code with your phone, it will take you right to their scheduling link where you can meet one-on-one virtually with one of our staff members. And they are very well versed in all things benefits and can help with a lot of those questions, or they can help refer you to another member of the HR staff if you have further questions as well. And then Jessica touched on this earlier, but I do want to emphasize again how important it is to review plan information during open enrollment. This is a huge point for helping maximize your insurance benefits. Even if you're happy with the coverage you have, even if you don't plan to change, it's always good to review what is changing and also take a look at your own coverage to make sure nothing on the plan, if you're staying on that plan, is going to alter, just so you don't have any surprises when the new year rolls around. It's always good to use that time to really explore what options are available to you. And that brings us to our last checkpoint of the day here, where we just want to hear from you about what benefits topics you'd like us to, or you would like to learn more about in the future. A big initiative of our team is to be here to support you and be a resource for you and make sure that we are offering valuable educational sessions to our employees across campus to make sure that we're giving you topics that are relevant to you, that if you have questions, burning questions that you want to ask us, go ahead and use that QR code to submit them through to our team. And we definitely want to hear feedback about what is most helpful for you in terms of educational presentations and how we can best be supporting you and equipping you as you navigate this tricky trail of healthcare and CSU insurance benefits. I'll also use this time just to check in with Jackie and see if there's any questions that haven't been answered from the chat that might be good to throw out for the good of the group here.
All right, thanks, Erin. There are a couple of questions in the chat. So the first is pre-tax or after-tax, or with pre-tax and after-tax premiums, which are more advantageous?
Yeah, that is an excellent question. I think the person, typically speaking, we will see more of our staff enroll in the pre-tax option because you do get a little bit of that tax savings, as Travis was talking about earlier, where you're getting your taxable income is being lowered with that option. That being said, there are certain circumstances where, for example, someone that is in para, close to retirement, might want their salary to appear, their taxable income to appear a little bit higher. So there are opportunities where it's advantageous to have it after tax as well. It really just depends on your goal and kind of where you are at in your career.
Great, thank you. Now, this second question is about beneficiaries, and it's a two-part question. The first is, can a beneficiary be someone living out of the country? And second, if a beneficiary is under the age of 18, how does that impact their ability to be a beneficiary?
Great question. Beneficiaries can live out of the country, and they can be someone 18, although neither of these are necessarily advised. For the second question specifically of having someone underage, we do recommend having someone who is of legal age as your beneficiary, at least as your primary beneficiary. Otherwise, a lot of the time that'll have to go through like a whole estate process and things with the Hartford or Security and our life insurance providers. So it is typically more advantageous to have someone over the age of 18 and someone living in the US. That being said, you can have someone outside the US though, and we can definitely still find them.
All right, thank you. Let's see, if we have experienced a mid-year qualifying event and need to enroll in benefits for the first time, what should we do after we send HR the relevant information or the proof of loss of coverage?
That is an awesome question as well. It depends really on your employee classification. If you are state classified, do go out to that Benefit Solver website that Jessica was talking about earlier to make those changes as soon as possible. You definitely want to get in the system sooner rather than later for those cases to make the changes there as well. If you are faculty, administrative professional, or other non-classified staff, our team will guide you through from here. We'll send you notification once the online enrollment system has been set up for you to go make those changes. So we'll kind of guide you through next steps from here.
All right, thanks, Erin. Looks like there's one more question here. Can you give a general overview of healthcare benefits that may be available after retirement?
That is a really good question and a really loaded question. We do have a lot of options available after retirement that are also dependent on your employee type, as well as which retirement plan you participated in when you retired. So for individuals who retire through para, you have access to para-care benefits directly through them. They do offer pre-Medicare and Medicare Advantage plans. For employees that are faculty, AP, or other non-classified staff that retire, and they retire with the defined contribution plan, which is administered through Fidelity. We have a couple options as far as coverage for bridging the gap until you become Medicare eligible. And then we do offer some subsidy benefits as well for those individuals after. So if you have more questions about that, more specifically would like to know what applies for you, definitely reach out to our team. We actually do have a specific retirement team. That's just hr_retirement@colostate.edu. If you want to reach out to that team, we can definitely look at your specific scenario, what employee type you are, what plan you're in, and that'll help dictate the exact answer to that question.
Perfect. Thanks for the summary, Erin. And I will go ahead and drop that retirement box in the chat as well, so everybody has that. All right, next question. I signed up for the accident and critical illness coverage from this year, but I have not received a card or communication. Should I have received something, or how do I find more information?
Yeah, great question. Thanks, Jackie. You won't receive a card for that coverage. You can just, if you have to file a claim, contact the Hartford and they'll guide you through that process of submitting the claim. So it's not a coverage where you get like a ID card you'll carry around with you. It's more of when occurrences happen, the Hartford, and they can guide you through.
Great, thank you. And are there ever circumstances where the 30-day window for a mid-year change can be waived?
That is an IRS regulation, so we do have to adhere to that 30 days. So we definitely stick with that as much as possible, and there are not many opportunities for exception, if any. So definitely keep that 30 days in mind because that's going to be super critical with those mid-year events where we do we do have to adhere to that because it is an IRS regulation as well.
Wonderful. Thanks, Erin. We can give it a minute or two. That looks like all of the questions. Oh, one more. Let's see. Are there any differences in employee benefits for non-citizens compared to U.S. citizens?
Great question. There should not be many differences as far as what you're eligible for here at CSU as an employee. There are, for J1 visa holders, if you are an administrative professional or faculty role, there is another plan option specific that for those individuals. Otherwise, the coverages really should be pretty similar across the board.
Perfect. And then Erin, really quick to kind of along that same line, other than generally speaking, the Pathways plan, can you do a really quick summary on accessing coverages internationally for our medical plans in particular?
Yes, absolutely. So for Anthem enrollees who are covered by one of our Anthem medical plans for faculty and administrative professionals, we do have, they have a partnership with Global Core. So you can access coverage if you're traveling internationally. It's going to be a little bit different of a process, of course, because out of the country, they can't necessarily process insurance the way they would here. But if you are traveling and you encounter an emergency situation, we always would encourage you to get the care you need. And then you can submit a claim through Global Core after the fact with Anthem to help cover that cost. And I'm not as familiar with Cigna and Kaiser, but I think they have similar programs available for emergency services out of country.
Perfect. I believe that is the case. So yes, you're right. We can definitely help refer you to the state of Colorado too, if you have any questions about other coverages. But that was a great summary. Thanks, Erin. All right, that was the last question in the Q&A. We can still give it another minute or two and see if anything else pops in the last few minutes here. I'll let you know if anything comes in.
Awesome. And I just wanted to thank you again all for spending some time with us this afternoon. I know time is so valuable at this very busy campus where you could have been many, many places this afternoon. So thank you for choosing to spend that time with us. If you do have follow-up questions that we weren't able to address during today's session, our contact information is up here on the screen, as well as a QR code. Oh, maybe I took the QR code off. Nope, just the contact information and the link to our website, and then our email there as well. And I do want to note that we're open for walk-in services or appointments Monday through Friday, 7:30 to 4:30 p.m., but we are temporarily located in the University Services Center, which is just one block away from our usual location on Howe Street. So if you do want to visit us in person, come on all the way up to the 6th floor and we'll meet you there. And we'll just hang around in case there's other questions, but thank you so much.
All right, thanks so much, Erin. I don't see, oh, one more question. Let's see what we've got here. Let's see. Can you please provide information about how employees access care if they're injured at work?
That is a great question. If you are injured at work, still go find that in-network provider to get immediate help for that injury. And then we do have our Office of Risk Management would want to work with you regarding if there's any type of workers' compensation claim involved. So that would be probably the best course of action. Just get the treatment you need, but also get in touch with that Office of Risk Management as well.
That sounds great. Thanks, Erin. That looks like that was the last question that we had. And again, as Erin mentioned, please feel free to follow up with us if you have any additional questions beyond this presentation. Thank you, everyone. Have a wonderful day. Goodbye.
Thank you.